I'm Dr. Erin Elliott.
And I'm Jason Tierney.
I'm a dentist.
And I'm a dilettante. And we're going to talk about sleep matters because
sleep matters.
Erin, Dr. Elliott, we're back.
And it's so good to be back.
Indeedly do. And today, we've got an esteemed guest, the one, the only, Dr. Steve Carstensen. Dr. Carstensen, how are you?
I'm very good, Mr. Tierney. And so I'm happy that you invited me. Please call me Steve.
Steve, we're jazzed that you're here. Erin and I, when we were putting together a guest list for today, you were numero uno. So we're jazzed that you carve out the time to talk with us. And, you know, I really like to just dive right in and ask you, because you've served on so many boards. You've played a role in directing the conversation around sleep in dentistry for so many years. And despite all of your efforts and the progress that you've made, we're still a long ways from where we need to be. So what is wrong with, let's just call it, for the sake of this conversation, unless you want to coin it something else, what's wrong with dental sleep medicine?
Yeah, Jason, and you're right. When I started teaching on this, after Dr. Thornton got me involved in doing sleep medicine, it became obvious that we needed more education. And I've been an educator all my life, and so I'll go out and talk about this. And then when I go out and talk about this, it's not uncommon for me to get involved with organizations that try and make a difference. So it's more than just a voice out there doing education. It's really a change in a profession.
Mm-hmm.
So I got involved with the AADSM a lot of years ago because that's kind of our organization of record, as it were. And I thought, well, here's the way to make this thing happen. And I was a little bit frustrated with how slowly that moved. But again, those were early days, and many of us didn't really know what the capabilities of dentistry was and the impact on community health through taking care of airway and breathing problems. We thought about it as, treating OSA and snoring back then.
Sure.
As now, as science and clinical practice have moved forward, then it's a matter of what can we do now to enlarge our scope, to think bigger, to be more curious, to be more active. And I have not found the organizations to be as interested as I am, certainly in trying to expand that and trying to move into a new role. It's kind of like they're trying to do the same thing, only better, which is not a recipe for growth or big changes.
What do you attribute that to?
Yeah, I thought about this since you proposed this as a topic, and I think it's just it's a fear of being put under review, of being chastised, or maybe of even being, you know, um, put down by what they perceive to be, quote, more important, unquote, parts of medicine. This whole field was defined by physicians. As looking back on the problem, it only became defined by physicians because they found it in hospitals under physician care. When we think about the basic mechanics, we have a closure of the airway. That's not really a medical problem. The medical problems come downstream from that, but it was defined that way. And so it became the realm of physicians. And now dentists come along and we think, okay, let's beg our way into this party, but we're clearly second class here. And I just don't agree with that. I don't agree with it now. When I was being trained, maybe in early days, I thought, well, okay, yeah, that's my role. Now I see it as a much different role. And that hasn't yet been embraced by the organizations. They still see themselves as second tier and having one treatment to apply. And that's really about it, as far as I can tell.
And what about, there still are a number of dentists that view managing the airway as simply mandibular advancement devices. Um, how do we get away from that and get dentists to take a more holistic approach?
Yeah, this is a conundrum right here, because on one hand, I see a role for dentists to treat uncomplicated people, medically uncomplicated people who have a mechanical closure of the airway with a simple device to undo that closure problem. On the other side of things, I believe that we should be curious about the downstream physiologic effects of these airway closures, especially over time. And that means that we have to be curious about those physiologic effects. We have to know what happens to cardiovascular problems. We have to understand brain changes, not to the point of being neurologists or cardiologists, but at least have a bigger understanding, a bigger appreciation
Mhm,
for that physiologic impact.
mhm,
Now, to be able to get there from here, it would be nice if our physician colleagues would consider us to be more like, you know, like doctors and less like DME providers, and indeed,
Hmm.
put on courses that actually trained us
mhm,
in
Together,
why
even.
we should why we should do something different, why we should talk to our patients differently, why we should be consulted as part of a treatment planning process.
I love that idea. But there's a few like we are going to have a podcast with Dr. Shane Criado, who is a sleep physician, and he loves our world and how eager we are to, you know, help people. Um, if we find enough of physicians like that, is that a place to start?
Well, there's outliers. Certainly, the 3 of us are on the forefront. That's why you have this podcast. That's why you invited me. Dr. Criado and others, Dr. Watson, Dr. Bijwadia, they all think that people should work together and dentists have an important role to play. But there are plenty of physicians that are in charge of things like the ASM and, who don't. They just don't even consider dentistry, or if they do, "Oh, yeah, the appliances."
mhm.
They don't really think of us as partners in physiologic evaluation and impact, and that's the thing. Well, I didn't go to medical school. I don't pretend to have medical, physician level understanding, but I'm also a doctor. I'm also somewhat trained, and so I
Mhm.
should be relied upon to be a partner in the process. Yeah.
Yeah.
We're more rel I feel like we're more educated than primary care doctors,
Yeah,
and they're expected to carry the torch and don't know what they're talking about.
well, the reality is, Erin, you're right. We have much more expertise, you and I and, others that we've trained that have been to those our courses, that have been to a lot of courses than any primary care physician has been graduating from medical school. But they have training that we don't have. And so the key
Mhm.
is not who has the most
Yeah.
training. The key is how can we partner up?
Yeah.
When I see sleep reports, when I see medical encounter reports of the patient's evaluation, their testing results, their recommendations for treatment, and listed on those reports are the patient's primary care physician, maybe an ENT doctor, a cardiologist, if that's important to their medical care, but never do I see a dentist listed there.
Mhm.
And that's a big, empty spot, I think, in medical training to look at us as partners in physiologic evaluation and planning for improvement.
So with that said, are you an advocate for, this sort of movement that this movement of outliers that, posit that dentists should be able to diagnose apnea?
Well, I think that dentistry is moving into primary care. I think we're being recognized. I want us to be called general dentists, as it were, that have an interest in this, a curiosity about better awareness of physiologic effects, to actually be primary care dentists, because we monitor blood pressure, we monitor, you know, disease response by our periodontal maintenance. We ask people about their medical history, and now we're getting into sleep, which is kind of the most overlap of the medical dental Venn diagrams that I can think of.
Hmm.
And that means that we have areas that we can evaluate, areas we can be responsible for.
Mhm.
Well, and then
So
there's the oral microbiome, leaky gut, like, so there's a course that I'm looking at because with my hygienist, but it's basically called functional dentistry.
yeah, there we
From
go.
a tube from here to here,
Right.
why aren't we more educated on it all the way down?
See, that's another great example, functional medicine, functional dentistry, oral microbiome affecting the rest of the body. That's all the reason why dentistry can be more than just the teeth, the gums, the jaw joints, and chewing muscles, and really start to be part of physiologic care or primary care.
Mhm.
Yeah, and I mean, this all sounds great. I think, we're the choir here preaching to one another. Uh, so what needs to actually happen for this to get some traction and make real change?
On a In an individual community, it takes a dentist that wants to be a part of this primary care to
Mm,
sit down with the primary care doctors of some of his patients,
mhm.
her patients, and to have a chat with them about how can we form this partnership, and then start to grow that by patient after patient saying, "Okay, let's consult together on these." That's the local effect. What will need to happen somewhere along the way is in the regulatory bodies of a state is going to be loosening of some of the barriers that are drawn around both medicine and dentistry.
Mm,
And not that I think physicians are qualified to do a filling on number 20, and I'm not qualified to listen to a heart to see if there's a murmur. But I think that there's enough overlap that we should be able to define the practice of dentistry in a little bit more than just, the oral facial complex.
What
But
about simply, like, being able to order a blood test to check ferritin levels for
the
restless leg symptoms?
See how complicated it gets so fast because, yeah, we
Yeah,
should be able to order that, but then who's gonna pay for it, you know? And then, if
yeah.
if in certain areas, if you order a blood test for that or you order a home sleep apnea test, then your state board comes and says, "Well, you're practicing medicine without a license," is the shorthand of that.
yeah.
And so all of a sudden, there's fear involved, and there's real consequences for that, and so that's
Mm,
a problem for enlarging this. Sadly, somewhere along the way, it's gonna take the courts, to be able to adjudicate something like this, and no, in fact, you weren't harming your patient by ordering a ferritin blood level, and in fact, that you should be able to be reimbursed for that, but that's gonna go back to the legislature, and how easy is that to work with, to look at things like the Dental Practice Act and bring them up to, 21st century practice as opposed to where they were drawn back, tens of years ago.
Well, in Idaho, it'll be great when I'm senator, so I'll get to work.
Vote
Mhm.
Elliott.
That's right. Governor
There's
Elliott.
there's an increasing number of organizations, and they are providing um, oral appliances to an increasing number of people. Um, and I'm referring to these direct to consumer oral appliance companies.
Mhm.
Um, what role do you see those companies playing in, tackling the OSA epidemic?
Well, I think that over-the-counter devices, like you might order from, Amazon or something, I don't have any problem with those because if a patient says, "Look, I have a problem enough to order something like this," well, they're never gonna fit well enough, and so the patient hopefully gets a glimpse into a preferred future where they got a little bit better, but they couldn't make this device work, and so
Right.
now let me seek a better solution.
Yeah.
The companies that are direct to consumer for actual mandibular advancement devices. I don't think they're
Yes.
gonna last any longer than Smile Direct Club did. So, they'll be around for a little while, but they won't be around for long because people aren't really satisfied with making their own medical devices. That's really not gonna work out well. There'll be some people that are hurt with this, that's the sad part. There'll be some people that are helped with it. Well, yay. Any way they breathe better is okay with me.
Mhm.
But ultimately, I don't think that's gonna have an impact on professional ways of improving people's breathing at nighttime.
Got it. And
I
and
agree.
back to, sort of the top of this conversation though, talking about, maybe some of the gaps that these professional organizations, are should bridge. I mean, I'll just ask you directly and you can sidestep or redirect. But I mean, do you think the AADSM has done a sufficient job in addressing these direct to consumer companies?
Uh, well, given that I don't really care much about the direct to consumer companies,
Yeah.
I can say that, yeah, they've done fine because, again, I don't really care what they do.
Yeah.
But that's not the battle that we should be fighting.
Okay.
The honest truth is that we should be looking into what we can do to expand, um, community health, improvement by any workforce that's available.
Mm.
And what workforce is more available than trained dentists to do this?
Mhm.
And that means that we have to reach out and we have to do more and claim more. Well, we have an organization that is fairly well focused on adult treatment. There's very little education, even in their mastery course, about growth and development of children, for example. And we can talk about that coming up.
Mhm.
But even just thinking about adults, they take such a secondary position. And when you ask them about other things that could be done, many of the organizations, many of the leaders, many of the people that don't want to see change rely on, well, there's not enough evidence for this. And they're using the term evidence based medicine to restrict
Mm.
what they're able to do as
Sure.
opposed to looking at what that really means
Mhm.
and what the organizations or other organizations are coming around to saying is, look, we've got to redefine how we use evidence in the 21st century here to establish solid ground to move forward with patient health without relying on some published RCT.
Mm. We had, on a previous episode, we had, Dr. John, a pediatric dentist, not Dr. John, the musician that, you and I both love, Steve, but, Dr. John, pediatric dentist, and he mentioned that, the American Academy of Pediatric Dentistry, that, in their CE requirements, I'm sure I'm jumbling terminology here, but in their CE requirements, they have to take some, airway courses to retain their licensure. I mean, do you foresee anything like that happening with the ADA?
Well, ADA doesn't require certain courses to maintain licensure. ADA doesn't do anything with licensure.
Yeah.
That's not the thing. They're a guiding organization. They don't have any legal situation that way. AAPD can maintain membership that way or have guidelines as well, but AAPD doesn't really control licensure of pediatric
Okay.
dentistry either. Now, what they can do is they can come out and say, "We suggest, we recommend, we think this is important," and that's all very, very good. I think that in the future, dentistry takes over everything there is to take over about airway management of traditionally developing children, not syndromic kids, but most kids.
Hmm.
And we think about the craniofacial respiratory complex. We deal with growth and development better than any other part of medicine. And orthodontists who care and pediatric dentists who care are going to be the ones that can lead the development of kids to where they don't grow up to be patients that Erin and I are treating these days.
Mhm.
And I mean, I wish there was a pipeline in place to where those 50-year-olds that I'm treating now, we weren't making more of them.
Mm.
But for a while, there's gonna be plenty of those. And But if we can do things correctly, then we start to recognize these problems early on. Dave McCarty and Kevin Boyd just published a really nice essay about this nomenclature. They talked
Yes.
about
Yes.
orthodontics. And did you read that?
Yes, I did.
And
Yeah.
their term is, I wrote it down, developmental dental facial orthopedics.
Mhm.
I love that term because it talks about what needs to happen. Developmental
Mhm.
and which can be any time in life. And dental facial orthopedics is really far beyond just the teeth, the gums, the way that things are aligned for pretty smiles and a good occlusion.
Mhm.
We need to be thinking about function, and we need to be thinking about it in 4 dimensions, really. 3 dimensions of the structure, and the fourth dimension of time. How long is what are we looking at any age, and what's going to happen over the next 10 years, and how can we influence that in a positive way?
Mhm.
And only dentistry can do that.
You've been involved in this field for so long, and you've tried to affect, and you have. I mean, you've certainly played an integral role in driving change. But I know that you haven't. It hasn't had the impact, as much impact as you'd like to see,
No.
and I guess this is more of a personal question. I mean, I would guess that at times this can feel like you could feel a little like Sisyphus. So I mean, what keeps you going? What keeps you motivated to get up every day and push that rock up the hill?
Well, really, it truly is about not trying to make more people that need to see me now. No, I don't know how I can tell you. I don't know how I can put into words, I guess, is the right way to say that. What keeps me motivated? Something does, and that it's easy for me to sit down and think about this. It's easy for me to, get in contact with people. It's easy for me to show up at a meeting. It's easy for me to advocate. My coach calls me a fierce advocate, which I enthusiastically embrace that term. And, because it really requires, a voice out there trying to make a change, and you're right, there hasn't been enough change. I've been, pushing on this for a long time, and I push hard on the ADA, and they make decisions that are contrary to what I wish they would do, but, all I can do is do my part. All I can do is contribute the energy that I have and the, attack in the places I think are able to make changes and be an advocate for that.
Mhm.
Do you see enough small changes that you're encouraged to keep going?
Yeah,
Like
yeah,
it's in the guidelines, the ADA guidelines now.
right.
Not
We
that
have the
many dentists
policy
read it.
statement.
Yeah.
Yeah, I'm sorry, I interrupted. We have the policy statement. We have more and more people like you, Aaron, that are out there saying the right things, like Jason putting together meetings that really can make a difference. And so the voices are gathering, and Malcolm Gladwell, one of my favorite writers, talked about introduced the concept of tipping point.
Mhm.
So at some point, it's going to tip, and then it'll be dentistry in the first few years, and then it'll be resolving a closing airway for a while, and then it'll finally be applying a CPAP when it's necessary. And I don't really mean CPAP is the final choice. I mean applying the right kind of treatment to the right patient because of a more precise type of a diagnosis and less of a blanket diagnosis and treatment plan.
Do
Like,
you feel like the
yeah,
consumers seem to be moving medicine that way? That I mean, truly, they don't trust physicians as much as they used to. And they're paying out of pocket for things that are good for them. Do you think that's gonna continue, where people start to become CEOs of their own health?
well, I mean, I typed in a word, a inquiry to open evidence a little while ago about evidence. How do we what else can we call randomized controlled trial evidence? What else can we look for? And, people can do that same thing now with AI out there. They're
Mhm.
able to get information. Now we have to be careful what they get, but they're at least walking into the physician's office knowing that they have to be a better advocate for their own health.
Mm-hmm.
And
Yeah.
that's a trend I think we can do nothing but encourage.
I
And
have a CPAP only sleep physician, and he has to refer to me. I'm sure he hates it every time, but the patients tell me they argue with him and demand it.
see, the more it's gone from the era where anybody is considered the last resort of information. It could be a physician, could be a dentist, it could be a lawyer, it could be an accountant. I mean, no longer do we look at professions that are highly trained as the only source of information about that
Yeah.
subject.
There's no single source of truth. Yeah.
There we go. And so what we can do now is embrace the partnerships that we can form with patients and end up with a truly precision and individualized treatment plan that might be a CPAP, might be a perfect
Mhm.
choice for them, but it might
Mhm.
also be a nerve stimulator, it might be weight loss, it might be
Sure.
an oral appliance. It doesn't matter. What matters is the patient thinks that's their best plan.
Mhm.
And
How
that takes a change of attitude more so than it takes knowledge base. But the AI driven informed patient is forcing that change in attitude.
What are dentists doing? What have you seen dentists do where they get in the way of some of this progress that you're mapping here?
Well, the dentists that are trying to that are in positions of leadership that warn other dentists noon, don't step beyond your boundaries.
Mm.
You know, don't step over the line because otherwise you'll be in trouble.
Mhm.
I mean, I remember distinctly hearing from the stage at AADSM. Now, this has been many years ago,
Mhm.
where a dentist and a physician stood up there and said, "Oh, you know, if you prescribe a home sleep apnea test, you might as well get your orange jumpsuit on."
I remember that
Lose your
meeting.
house. Lose
Yeah.
your house.
Yeah, exactly. And so, I mean, times have changed, but some of those attitudes haven't changed.
Mm.
You know, if you take too much charge of this, then you're gonna get in trouble, you
Mhm.
know?
Mhm.
And so it's a fear-based situation. You know, when you're afraid of your income stream, if we're afraid of your profession becoming sidelined, if you're afraid of, you know, getting a phone call that is challenging, then you're gonna become more cautious about what you do.
Yeah.
And when fear takes over, you'll also lose opportunities to have a bigger impact.
I wanna read a text to you. I'm not going to share the source, but, I think this is relevant to what you just said. Um, it reads, "I'm very concerned dentists are really trying to go beyond their scope of practice and will cause a big discord between dentists and physicians. Hopefully, can keep, yeah, and hopefully they can work together more to help patients." I just paraphrased the last part, but the key sentence there is, "I'm very concerned dentists are really trying to go beyond their scope of practice and will cause a big discord between dentists and physicians." So you sort of just touched on that, but after hearing that, what would you say to that person?
I would say the person who wrote that, who said that, is more afraid of that discord part. Because if another way of thinking about that is, I'm afraid, is dentists going beyond their quote scope of practice, oh, provide an opportunity for us to work together to find a better solution.
Mm.
Because those dentists that are willing to step beyond the barriers, to look further than what their dental school training showed them, those are the people that are easiest to work with if you're interested in reaching out from the other side as well.
Yeah.
But if you're more concerned about your territory,
Yeah.
then that looks like discord as
So
opposed to
because I don't understand why home sleep tests aren't a part of your annual blood work and everything else you get.
Mm.
Um, so when I'm lecturing, I will ask the audience, like, how many of you own a blood pressure cuff? And pretty much everyone raises. I'm like, how dare you? How dare you practice medicine? How dare you use a tool that may bring to light a disease that the patient doesn't even know they have? my point being, like, and then I ask them, "Are any of you?"
You're gonna be burned at the stake.
I know. I said, "Are any of you diagnosing hypertension?" And they're like, "No." I'm like, "Are you prescribing medication for hypertension?" "No. You're simply using a tool that brings it." So my point, I think, is made that having a home sleep test unit is not practicing medicine. We have a diagnosis from a sleep physician, and we have a prescription for the appliance from a healthcare provider. Can keep you out of trouble for sure, but obviously, I just think there should be no fear to get people the help that we know they need. Just another quick little story for the State Board of Idaho. There was a bit, was it like 4 or 5 years ago, Steve, where the president of the AASM sent a letter to the state dental board of every state demanding that we halt sleep tests, all these things. And so the state board actually invited me to call in and give them my opinion. And I kinda used that same analogy. I told him how it would really, restrict access to care, and basically, someone in the state board said, "You know, physicians don't ever come and ask our opinion on decisions they make. Why are we worried about theirs?"
Yeah.
And that was that. So,
Yeah,
we don't have restrictions here, but
you have fewer restrictions than most states, actually, in Idaho, because the AADSM did a survey a few years ago, and they asked, I think, wrong questions, but one of the questions they asked about was, home sleep apnea testing in your state, what do you think? And Idaho came along and said, "We don't care what they do, they can do whatever they want with it." And, most states, had no answer. And then a few states said, "Oh, you're right, we shouldn't let them do that." So that was a problem. That's mitigated a bit, but New York just restricted that now.
oh, yeah.
Yeah, dentists can't touch a home sleep apnea test in New York.
Hygienists can't do myofunctional therapy.
See,
That's out of the scope. Who in New York is gonna do that?
so
Dentists aren't.
so it's an example of why we don't have national leadership, and in healthcare, there isn't national leadership. We look at organization like AMA has about what 30% of people
Mhm.
physicians are in AMA now. Less than half of dentists are in ADA now, and so who speaks for the groups? And it turns out loud voices get heard.
Mm.
And so if you have an AASM and a DSM that are intent on maintaining the differences, then that's going to persevere for a little bit too long. Yeah.
Yeah. So we need to be louder.
Yeah. There's a
Get
few of
louder.
us.
Yeah.
I just got named a fellow of the AASM, so I'm trying
Congratulations.
to bring that, you know, to make dentists more involved too. But if you look at the sleep meeting, their big meeting, I think there's 2, maybe 3 dental, talks, maybe 1 in the whole week that they have together.
And who do they have
They have the
representing dentists?
usual suspects. I think it's Fernanda probably. I haven't looked. I looked a few months ago.
Mm.
Yeah. But again, there's not I mean, years ago, we at least used to have, adjacent meetings, not intertwined, but at least adjacent meetings, so, people can go to both meetings.
Mhm.
Now they've made it to where it's 2 separate meetings, and that's just the wrong move. So, bigger organizations now organizations with wider reach, let's say, and they're not bigger in terms of numbers, like the World Sleep Society,
Mhm.
and are getting together people and they don't care about labels. I go to World Sleep Society meetings, and dentists, physicians, myofunctional therapists, physical therapists, they're all in the same room.
Mhm.
And nobody cares what's on your badge. It's just are you interested in learning?
Awesome.
Well, let's have a chat.
Mhm.
And that's so much more refreshing.
So how do we replicate that here
Well, the
at scale?
yeah, that
Same.
scale.
Well,
The
okay.
Large
World
scale.
World Dental
To
Facial Sleep Society, Audrey Yoon started up with Leopoldo Correa, and that's much the same way. We're trying to talk about, uh, s you know, who do we need to listen to, and it's not just the dentist, it's not just everybody's invited. We put our meeting adjacent to the, sleep meeting this June so that we can reproduce this collaborative effort, that's the point.
Mhm.
Um AAPMD, AOSH, both are looking at how do we blend the thinking behind what a dentist can contribute, what a physician can contribute, what functional medicine can do, what physical therapy can do. So there's smaller groups, but that's where the passion's growing. Yeah. If
Got
that
it.
helps any. Yeah.
Cool.
Yeah. So, Steve, this is a time where it's been all serious business up until this
Oh.
point, but this is the time where we play a little game called the Final Countdown.
No.
Yo, yes, this is it. So we're going to ask you.
Final countdown.
Yes, we're going to ask you 4 questions, and you'll have a total of 20 seconds to answer these 4 questions.
All
That's
right.
the final countdown. Are you ready?
Let's see how I do.
All right. If money was no issue, not a factor, what job would you do?
I'd be a roadie for a rock band.
Yeah, you would.
Have you ever, Steve Carstensen, been fired from a job?
Last summer, I was fired from a job.
Okay. And what is the worst movie of all time?
Oh gosh, I'd have to go with what's that crazy one from the desert? Well, let's go with Geely. That's easy.
Okay.
Yeah.
And then you are entering you're entering the ring. What's your theme song?
Well, I'm Tired by Eric Clapton. Let's go with, I'll say that one.
All right.
Sorry.
No, that's
Somebody did.
fantastic. Thank you.
Too many.
I've been to a
too many
music show with Steve.
songs.
Yeah. Well,
I know he likes his music.
Steve gifted us some records when he came to the TDS after party. And
That's
I came
awesome.
home the other day and Alicia was dancing around the house. And I was like, what are you listening to? And she said, it's one of the records that Steve gave us.
Good.
So yeah, it got Alicia dancing around the house on a Saturday morning.
Mission accomplished.
Yes.
You know,
Yes.
to make you and Licia smile and have a happy time. That was the whole point. Great.
Mission accomplished. Life is good. So yeah, Steve, I have learned so much from you over the years. I remember when I was at the dental lab many, many years ago, I would use videos that you had created for a different company to train our team on mandibular advancement devices. And just over the years, I mean, I've learned so much from you, and your willingness to collaborate and coordinate with so many seemingly disparate groups, I think is really admirable. And it's a lesson for all of us not to, reside in these silos and instead to build bridges. So
Amen.
from myself, from Erin, from us here at Sleep Matters, thank you.
Thank you.
You're
One of the
welcome.
best.
Years ago, when I was part of Pride Institute, I went to Jim's Pride's office, and on his desk, he had a plaque that said, "You may be smarter than me, but you're not smarter than me and my team." And I've taken that to heart ever since. And whether it be my office team or my team of friends, team of fellow enthusiasts for getting dentistry involved, all of us is smarter than any one of us. And so that's always what I've thought about.
It's a
Love it.
great thing to end on.
Yeah. Steve, thank you.
Thanks, guys.
All right.
Sleep Matters.